Hey everyone, it's Naomi Wolf of Hey everyone, it's Naomi Wolf of Daily Clout, and I'm here because today, Wednesday, the third walkout day. I hope you're all walking out to show support for the anti-medical mandate movement. But I wanted to talk to you about the New England Journal of Medicine preliminary findings of mRNA COVID-19 vaccine safety in pregnant persons by Shimabukuro and colleagues, which was published in June of this year and which has been widely cited by the CDC in their claims that the mRNA vaccine, I hope that YouTube will let me get away with saying that word, it's like Voldemort, are safe and effective. And a new peer-reviewed study has come out. The Epoch Times reported on this, showing what the flaws are in this study and calling it out essentially as bad science that the CDC should not be linking to and should not be citing in telling pregnant women that the vaccine is safe and effective. It's actually against laws for the CDC and the FDA to claim something is safe and effective if there are not data to support that, if that's not true. So I'm really happy that another peer-reviewed study has called this bad science out. We at Daily Clout were the first to widely call attention to the incredible flaws in this study. And you can put your chats in the chat box and I'll respond to them. But first of all, this study, you think that it's actually like doctors reporting clinical findings, of verified pregnant women. It isn't. It isn't even a study of pregnant women. It is a study of self-reported people who identify as pregnant on a phone app. So I'm a big supporter of self-defining your gender, but I think it's a pretty huge flaw in this claim of this study that the mRNA vaccines are safe and effective for pregnant women, since there is nothing in the parameters of how this study is designed to guarantee that it's women who are pregnant who are even the subjects of the study. I doubt this happened, but the way this study was set up, anyone for a prank could download the VSafe app and get all their frat brothers to identify as pregnant people or people who identify as pregnant and be included in this study. So they used data for 3 months. So flaw number one, December 14th, 2020 to February 28th, 2021. 2 months, I beg your pardon, December 14th, January 14th, February 14th, 2.5 months to do a pregnancy study. So I guess that's flaw number two. How long is a pregnancy? It is 9 months. So you are getting a fraction of a pregnancy in this study. So the authors say we used data from the VSafe after vaccination health checker surveillance system, the VSafe pregnancy registry, and the VAERS to characterize the safety of the mRNA vaccines. So they say a total of 35,691 VSafe participants, remember a phone app, between the ages of 16 to 54, persons, not women, identified as pregnant. Could be Pfizer employees, after hours, identifying as pregnant. They reported on injection site pain. And then they said of all of these 35,000 participants, 3,958 and 827 had a completed pregnancy, of which 13.9% were pregnancy losses, meaning spontaneous miscarriages, or also called spontaneous abortions, and 712, or 86.1%, were live births. So this is really interesting, weird numbers, because they took a giant pool of 35,691 participants, right? That's what they're going to claim. They're going to claim that it was a study of 35,000, almost 36,000 women. But it wasn't a study of 35,000 or 36,000 women. They only looked at a fraction of that, almost 4,000. Of which only 827 had a completed pregnancy. In other words, they didn't follow 36,000 women to the ends of their pregnancy. They followed 827 people who identified as pregnant on a phone app for 2.5 months. So really process that, absorb that, all right? And of those, there were 115 pregnancy losses in 2.5 months. And no neonatal deaths were reported. Well, of course, no neonatal deaths were reported, because think about, like, let's not be enumerate here. Think about a pregnancy. They looked at a less than 1 trimester of a 9-month pregnancy, and no fetuses died as newborns, right? That's what neonatal means. Neo means new, natal means born. Because the overwhelming number of the pregnancies were not over. They didn't see the babies to know if they had been born as stillbirths at the end of 9 months. Although not directly comparable, and these are the weasel words you see a lot in, CDC and FDA science, Moderna science, Pfizer science around this pandemic, now endemic, now not even in the top 10 causes of death. But they say, although not directly comparable, calculated proportions of adverse pregnancy and neonatal outcomes in persons vaccinated against COVID-19 who had a completed pregnancy were similar to incidences reported in studies involving pregnant women that were conducted before the COVID-19 pandemic. So really process that, and I'll put it in English for you, because we have to get used to understanding these things. They're not too hard for us. They were not comparing apples and apples. They were not taking 4,000 pregnant women who had the mRNA vaccine and 4,000 pregnant women, a control group, who didn't have the mRNA vaccine at the same time, in the same context, same demographic. They were cherry picking 4,000 women out of 4,000 people who identified as pregnant, and modeling or projecting that there are other studies out there in the world prior to the pandemic that found comparable outcomes, were similar to incidences. So those are weasel words. There's no table showing the control group of unvaccinated pregnant women with a control group of vaccinated pregnant women. That does not exist. All right, conclusions. Preliminary findings did not show obvious safety signals among pregnant persons who received mRNA COVID vaccines. However, more longitudinal follow-up, meaning maybe it's good science to follow the pregnancies to the end of the 9 months and see what happened to these women and their babies, or these pregnant persons and their babies, including follow-up of large numbers of women vaccinated earlier in pregnancy, is necessary to inform maternal, pregnancy, and infant outcomes. And this is right here, New England Journal of Medicine, and that is June 17th, 2021. And I am telling you this because these authors did not say what the CDC is saying they said, okay? These authors said there isn't enough data to tell women that it is safe and effective. They're saying more longitudinal follow-up is necessary in order to inform people of what these outcomes really are. So these are huge disparities between what these already bad scientists found by distorting and cherry picking the data versus what the CDC even said they found. So let me also say that they say that they tell kind of the history of the relationship of the vaccine to pregnant people. And then they say pregnant persons were excluded from pre-authorization clinical trials, and only limited human data on safety during pregnancy were available at the time of authorization. Meaning, when these emergency use authorizations were rushed into effect and the CDC said, okay, go, it's safe for pregnant women, these scientists are acknowledging that that pregnant persons or pregnant women in a stretch were excluded from the clinical trials that the manufacturers did prior to the authorization for use in pregnant women. And they said only limited human data on safety during pregnancy were available at the time of authorization. They were saying, we don't know. When the EUA was passed last November 2020 or late in 2020, no one knew if they were safe for pregnant women, but pregnant women were told they were safe and effective. Then they say, however, pregnant persons with COVID are at risk of extreme severe illness. No doubt that there no doubt are risks for COVID. And then they warn what the various risks are. Post-authorization monitoring in pregnant persons is necessary to characterize the safety of these new COVID-19 vaccines, which use mRNA, lipid nanoparticles, and state-of-the-art manufacturing processes. I'm going to say that again. You've got to hear me. These authors say post-authorization monitoring. We need to keep looking at pregnant persons, meaning at least women, is needed to even say anything about the safety, I'm shouting, so I'm getting hoarse, of these new COVID-19 vaccines. Excuse me. These new COVID-19 vaccines, which use mRNA, lipid nanoparticles, and state-of-the-art manufacturing processes, meaning these are completely new technologies for pregnant women or pregnant persons. And they're warning that more study is needed before even characterizing them as safe. And they also note that in the VSafe system, enrollment is voluntary. How did the study work? They sent text messages to the phones of the participants. And during the first week, participants are prompted to report local and systemic signs and symptoms. So sure, you're going to tell a phone app if you've lost your baby, God forbid. And if participants indicate that they require medical care at any point, they're asked to complete a report to the VAERS through active telephone outreach. So it puts the burden on this busy participant who's already pregnant to stop everything and file a VAERS report, which is quite difficult, in order to gather adverse effects. In other words, the app itself is not set up to have an option, I lost my baby, or my baby was born with missing limbs, or I have gestational diabetes, or any of the many things that can go wrong. How you find out, and this is like so sneaky and evil, they tabulate the bad data by putting the burden on the study participant to do something completely separate in a completely separate database, the VAERS database, and then it gets fed into the system theoretically. And the last thing is that these persons who identified as pregnant are then contacted by telephone, and if they meet inclusion criteria, are offered enrollment in the VSafe pregnancy registry. Eligible persons are those who received vaccination during pregnancy, or for persons who chose to enroll. It's a phone-based survey in which birth outcomes and contact information is requested. So absolutely no verification, no doctors involved, no hospitals involved, no death certificates involved if the baby dies. And then for analysis of pregnancy outcomes, the VSafe Pregnancy Registry, data were restricted to completed pregnancies, i.e. live-born infant, spontaneous abortion, induced abortion, or stillbirth. So they excluded all the other things that can happen during pregnancy. Participant-reported pregnancy outcomes included pregnancy loss, spontaneous abortion and stillbirth, small size for gestational age, preterm birth, and you can see that in the appendix. They don't include that there. So again, and the VAERS reports involving pregnant women included only 221 persons. So you see what happened. They took this giant pool of 36,000 women, and they said, we're going to call this our pool of women we're studying, or people we're studying. They had them report by phone. If God forbid something horrible happened to their baby, they're mourning a lost pregnancy, they're mourning a miscarriage, they're mourning a deformed baby, they are supposed to take the time to report it to VAERS, a totally separate database, not to these folks. And then they finally look at VAERS reports involving pregnant persons of only 221 persons. So it's not even the same group, right? Do you follow this? It's not even the same group that they start with and that they end with. And how did they analyze it? With software. And I can tell you that with software, you can count anything you want. So it's not human scientists or human epidemiologists or human CDC workers or government workers tabulating the numbers of pregnant persons who lost their babies, whose babies were deformed, whose babies failed to thrive, whose babies were underweight, who had gestational diabetes, who had horrible blood clotting, who had to lie in bed. Nothing, right? Nothing was being tabulated by human beings. It was an app counting the outcomes, and I develop software. I am a CEO a CEO of a tech company. You can do anything with software. You can count anything with software. So those are some of the main flaws. I could go on and on, but it's the VSafe registry. Oh, here's one. As of March 30th, 2021, the VSafe Pregnancy Registry Call Center. So it's not, again, not scientists looking at the data. It's a call center that could be in, the Philippines or in Malaysia or in, Detroit, staffed by people who may or may not have, no disrespect to them, a high school education asking the questions, right? It's not scientists. It's either being tabulated by a machine reading app, which you can do anything with, or a call center, people on minimum wage. Of the 5,230 persons who identified as pregnant at or shortly after COVID-19 vaccination, of these, 912 were unreachable. So almost one-sixth of the now down to 5,000 persons that a call center is calling were completely unreachable. Okay, 86 declined to participate and 274 did not meet inclusion criteria. What does that mean? They were never pregnant, or they were vaccinated more than 30 days before their last menstrual period, or they didn't provide enough information to determine eligibility. So they were flawed subjects anyway. So now you're down to like 3,500 people. Most were, an overwhelming number were non-Hispanic white people, almost 80%. And that is also distorting the data because our country is not overwhelmingly 80% white. It is diverse. And so this was not representative as a population. This was healthcare workers, actually, most of them who know about nutrition, have access to healthcare. They don't include the demographics of women in low-income communities, women who disproportionately have higher low birth weight outcomes, problems with babies, poor nutrition, not enough checkups, and so on. They excluded those. And so finally, they ended up with 827 participants who had a completed pregnancy out of 36,000. So they're saying 36,000 women were tested for it to be safe and safe for pregnancy. But no, when you follow the trail of data to the end, 827 people who identify as pregnant completed the pregnancy. A live birth resulted in only 712. So that is a very high number that is 14% of not ending in a live birth. 104 of them, or 12.6%, had a spontaneous abortion, stillbirth 1.1%, and there were other outcomes, including ectopic pregnancy in 10. So now you're down to a fraction of hundreds. You're down to 650, live births out of 36,000 women. A total of 96 of 104 spontaneous abortions occurred before 13 weeks of gestation, and adverse outcomes among 724 live-born infants. That's all you're down to, right? Out of 36,000 people, you've got 724 live-born infants, including 12 sets of multiple gestation. Pretty interesting. Were preterm birth. 60 of 636 among those vaccinated before 37 weeks. That's 9.4%. Small size for gestational age were 23 of 724, or 3.2%. And major congenital anomalies, 16 of 724, or 2.2%. So that's that's the headline there. Out of 36,000 people who identified as pregnant on a phone app, they ended up with 724 live-born infants, 12 sets of multiple gestation, preterm birth for 60 out of 636, and small size for gestational age, 3.2%, congenital anomalies, 2.2%. So that's a total, if these are different subsets, of about 12% of those 724 live births, something was wrong. And that's only the babies that made it to term. So that's my analysis. Thank you for listening. This is the worst science in the world. And these, with these outcomes, I'm not going to tell you what to do. These are very personal decisions. But a lot of women, I have my babies, they're grown up, they're big, thank God. A lot of women of childbearing age are deciding right now, should they be vaccinated? And these are the facts. These are the risks, and this is the quality of the data, which is absolutely appalling. And as a feminist who cares about women's health, I think this is criminal and scandalous. This is Naomi Wolf for Daily Clout. Please share, please like, please subscribe, and please donate. We keep our doors open at Daily Clout, bringing you real reporting, real firsthand analysis, and Bill Camp, which lets you drive your own legislation. And we need subscribers and donors to keep our doors open. Here's Roscoe Rossi. And lots of questions. Julie Marr says, thank you, Naomi. Roscoe Rossi says, I came in late. It'll be live. And lots of questions and comments. So please share, please donate, please subscribe. This is Naomi Wolf of Daily Clout. And please be informed, especially ladies who are thinking about giving birth. Bye-bye.